Animation for the hypothesis that the cervix dictates the pregnancy interval and circadian timers through exponential uterine wall tension with light-dark cycle modulation. Dr. Ali Hegazy, Department of Obstetrics and Gynecology, Portiuncula University Hospital, Ballinasloe, Ireland, and Blossom Medical Communications, Houston, USA. The smooth muscle of the uterus during pregnancy presents a unique circumstance of physiological mechanotransduction because the tissue remodels in response to stretching imposed by the growing fetus. Yet the nature of the molecular and functional adaptations remain unresolved. We hypothesize that exponential uterine wall tension, EUWT, is the functional component of the uterine mechanotransduction, and the intrinsic myometrial cell character, IMCC, is the molecular one. IMCC enables the uterus to control its function autonomously and intrinsically secondary to tension change, where high tension induces relaxation and low tension induces contraction. EUWT is created autonomously through a complex interaction between the gestational sac, the uterus, and cervical support. EUWT, via mechanotransduction and direct progesterone estrogen effects, induces inhibitory and stimulatory systems. To answer, what is the primary function of the cervix during pregnancy? What is the mechanism that initiates labor when the cervix loses resistance? This study investigates the current evidence base that may support the hypothesis. A 40-second 3D animation supporting the hypothesis was developed in conjunction with Houston-based Blossom Medical Communications. Gestation is a balance between two opposing interactive forces, mechanisms, and systems. The first force is EUWT. It causes myometrial stretch. It induces the inhibitory system, which maintains pregnancy in addition to direct relaxants. The second force is the stimulatory system. It is due to myometrial contraction. It terminates gestation by transforming the cervix into the lower uterine segment, LUS. Autonomous two-system interaction secondary to light-dark cycle modulation divides gestation into 5 clinical phases: growth, maturation, transition, parturition, and involution. Growth phase. From conception to 30 weeks, EUWT rises. The cervix is a T pattern. The inhibitory system is dominant. Maturation phase. From 30 to 37 weeks, EUWT is ascending to the peak. The cervix transforms into the lower uterine segment, LUS, nocturnally through TYVU pattern, secondary to maternal cortisol modulation of the inhibitory system and melatonin and oxytocin on the stimulatory system. Transition phase starts after 37 weeks when EUWT fails secondary to complete loss of the cervical strength until the onset of labor. Its duration varies from a few hours up to several days, depending on the maturity of the stimulatory system. Parturition. During the first stage, the cervix dilates due to upward inversion of cervical U pattern, with the complete transformation of the cervix into the LUS, followed by delivery of the baby in the second stage. Involution phase, up to 6 weeks. The clock metering the duration of pregnancy has been suggested to consist of 2 interacting timers: an interval timer measuring the overall length of gestation, and a circadian timer defining when, within a 24-hour cycle, birth takes place. The pregnancy interval and circadian timers are achieved by a single mechanism: EUWT failure, secondary to the complete loss of the cervical resistance nocturnally at the end of the maturation phase. The creation, the autonomic maintaining, and eventually the autonomic termination of the EUWT through light-dark cycle modulation make gestation an autonomic cycle with a constant interval and circadian timers. Gestation is genetically controlled through the complex interactive EUWT components, which makes gestation an autonomic cycle with constant duration. Malfunction of any EUWT component terminates the gestation prematurely or post-term, or leads to dystocia in labor.